Hi, everybody. This is Mike Carberry, Dr. Mike Carberry here with a special guest for our webinar this week. We have Mr. Stu Hoffman of ChiroSecure. Stu, welcome. Good to see you.
Appreciate it.
So we're going to talk to Stu. I know we have a lot of chiropractors that watch our webinars, and many of you know who Stu is, Stuart Hoffman, ChiroSecure. You've been involved in malpractice and chiropractic for a long time now. When did you first get started?
Well, I graduated Life University back in 1981, and I practiced for many years up in Michigan, which you wouldn't have known. And from Michigan, I came out to Arizona, and I had, over my course of time in practice, I've had 14 offices, and I've had over 50 doctors working for me during that period of time. And I had somehow got asked to put this malpractice insurance program together originally for the International Chiropractors Association. And no one expected it to happen. We're talking before, text messages and cell phones, before email and fax machines. It was something you had to make long distance phone calls, make connections to connections to connections, but we got it done. And at some point in time, it needed somebody to take over the day-to-day operations of it. And I had sold off some of my offices at that point in time and got focused on this because someone said to me, why don't you treat it like it was your office where the doctors become your patients? And at that point, everything really changed. And I've always taken care of this business as if the doctors are my patients.
Got it.
Yeah.
Okay.
So I've been around for a while, Mike.
Okay, yeah, and I'm embarrassed to say I didn't know you were a doctor, so I apologize for that.
That's all right. I am a chiropractor through and through. Everything I've done since I was 18 years old has been to be and support the chiropractic profession.
Well, good. We're glad that you're doing that. So let me just ask you, you've been with chiropractic, for a long time. You've been involved in malpractice, not quite as long, but also a long time. What have you noticed with malpractice in the last couple decades?
It's interesting. This August started our 28th year, and it has changed dramatically. First and foremost, if you take a simple injury issue, like a broken rib, it happens. When I first started, that was a $3,000 to $5,000 lawsuit. Now we've had lawsuits for broken ribs up to $150,000.
Wow.
That doesn't mean that they get that. It's just what happens in this day and age. Because attorneys are there just like anyone else to make money. And if you find the right attorney, they'll sue for anything. We all know that. Mm-hmm. But we have a lot more what I would consider frivolous lawsuits. But the biggest change over all of the years when it comes to chiropractors is the stroke issue. And years ago, if we had 1 or 2 stroke calls in a year, well, we'd be concerned. Now, if I get less than 4 or 5 calls in a month, it's a great month. Yeah, it's a big, big difference. And the simple reason for that, by the way, is that emergency room doctors are taught that when someone comes in with stroke-like symptoms, the first question you ask is, have you been to a chiropractor?
Right.
And they don't ask, have you been to a massage therapist, a physical therapist, an osteopath, have you been to healing, or anybody? It's only a chiropractor. So there's a lot of association rather than causation.
It's interesting you say that because I just read an article last week that showed that the research has shown that chiropractic is almost impossible to create a stroke. And it was medical research, not chiropractic research. No. And they said, but they still won't stop the emergency room doctors from asking that question, which is why we get these lawsuits.
That's exactly right.
Yeah.
We've actually spent in the millions at this point in researching everything about strokes being associated with chiropractors and how to defend them. And the last two stroke claims that we had, most claims never get to court, but the last two that did, we wound up winning. And that's great. Doesn't mean the next one will be the same or the one after that, but we're in a lot better position than we had been. But the doctors also need to take responsibility and make sure things that you teach, their documentation is proper and all of that. Because, years ago, I had a claim that we had our expert review, and I get a call from the claims department that they're going to settle this for max policy limits. And I said, I read the claim. This is totally defensible. So I asked the expert, what the heck is going on? He said, well, did you realize that we can't put him on the stand? No. He said, well, he forgot that a year and a half ago, he sent the patient's records into an attorney. Okay. Well, now when he was asked for the records, they're totally different than the set he sent in the first time.
Really?
You just can't do that. They'll take your license away. You're going to lose. There is no good outcome. But people get scared and do things that back and haunt them.
Yeah. Well, we teach good documentation on the front end, not on the back end. That there is no good documentation on the back end.
No, for that.
So, yeah, that's pretty amazing. I did not realize that about the strokes either. And it's funny that you brought that up because I just read that article and it totally vindicates chiropractic. It's almost impossible. They said taking medication to prevent stroke probably has more of a chance of causing stroke than going to a chiropractor.
Exactly. My statement when I teach seminars is that a chiropractic adjustment cannot cause a vertebral artery dissection in a person that has healthy arteries. Now, what makes them susceptible to being unhealthy? Medications are one of those things. If I can give you one example, we had a claim of a 67-year-old woman who wound up with a thrombosis at her brainstem. It was the size of a golf ball. And I said to the doctor, take out a case history because I'm the one that gets the calls, my son Eric or myself, usually the first call. And take out the case history. 67, she has to be on a dozen medications. Well, it turns out he had two listed. One was for heart issues. The other one was for osteoporosis, the number one drug for that, which is Evista. I look it up, and Evista has a black box warning, meaning they know that this is serious complications and common. Right. And it causes venothrombus embolism that can lead to stroke and death. They didn't sue them or the medical doctor. They sued the chiropractor who happened to be in the wrong place at the wrong time.
Right.
That's what happens. So
right.
That's the biggest change I get to see.
The other thing that they warned about in the articles, they said one of the symptoms of a stroke could be headache or neck pain. And this person coming into you might be in the midst of a stroke. And it's good to do some diagnostics and be a doctor and actually determine what is causing this person's problem. So
totally. We teach that as well. There are actually 72 everyday activities that are known medical causes for a dissection. And, people are going to come in with headache or neck pain, whether it be to the chiropractor or their medical doctor. And the big difference is they're going to tell the doctor, this is something I've never felt or experienced before. Red flag number one. And they're going to usually describe it more as like a thunderclap type headache. So These are just some tips for the doctors to just keep in the back of their mind, because we like them to come from a service perspective, not a defensive point.
Right. Good point. So you might have already answered this, but what is the likelihood of someone actually using their malpractice?
Well, it's more and more common. And it's not always for injuries like an alleged stroke issue or broken rib or something like that. We probably have 20 licensing board issues that we have to defend compared to one actual injury claim. And that is what's big. Remember, back in 1981 when I started, if someone wanted to make a complaint to the licensing board, First of all, they'd have to find them. They're not in the yellow pages. They're in the back section of a white pages for those people that know what those things are in this day and age. And once you called them long distance, which was costly, they would have to mail you a packet. You'd have to open it, fill out by hand these forms to make a complaint, put postage on, and mail it back. Most of the complaints, unless they were really serious or real, would just go away. Now it takes a nanosecond through Google to find the licensing board. On the homepage is a complaint form, and they have a legal obligation to research any complaint that comes in. So, you know, I dealt with one just this morning, and the doctor was simply telling this patient that had a diabetic issue that he can help. Well, she understood it to say he can cure diabetic patients.
Right.
He gave her a discount on day one, offered her to come back for day two at $90. She thinks she couldn't see her x-rays unless she paid him $90, but that was actually for her first adjustment in this particular case. And the board is now on his back, and we're going to be dealing with that over the next number of months. But there's just so many things, including, you know, money is always an issue, and communication is the number one issue.
Right. Yeah, we stress that as well. So what can our guys do to minimize the chance of a malpractice suit?
Well, I would say two things. Number one, be very, very clear. Like you said, you stress the communication factor, and so do I, because that is where all the upsets usually stem from. And the upset, even with communication, usually goes all the way back to dealing with money. So the clearer someone can be with that, it's going to just move everything along much, much better. I recommend that the doctors utilize our informed consent. It's something that we spent 1.5 years in developing because of the stroke deal, and I don't want to acknowledge that a chiropractor can cause a stroke, so we use it almost as an educational tool at the same time. And we've long ago learned that informed consent, which is required in some states but not all, is really something that's for the patient. But in fact, the same form really is what protects the doctor, because any legal lawsuit in terms of malpractice has three major components. Number one, was there negligence? Number two, did the doctor deviate from the standard of care, whatever that may be? And the third is the patient wasn't informed of the risk. Well, you know, if you have the informed consent, they're still going to have that because they use templates, but at least it gets rid of 1/3 of the issues right then and there. And I think that that's been a strong asset for us.
Good. Okay. So how about when people buy malpractice? I know I always had a lot of doctors asking me, well, what do I get? And I always get confused with it. I know the type of policy I want, but I get the terms mixed up. So what are some of the mistakes a doctor can make when they're buying their malpractice?
Yeah. Well, let's address the confusion. The confusion always comes about an occurrence type policy versus a claims made type policy. I always preferred the occurrence, although it doesn't matter. It's what you're comfortable with. Claims made is an occurrence policy, is an owner's policy. Once you have coverage paid for, that coverage can never be taken away. It's there forever. Even if you get rid of the policy and someone sues you later, you're always covered.
Right.
Claims made is more of a renter's concept, where when you want to get rid of the policy, you have to either purchase or become eligible for free tail coverage. And that always adds a little bit extra risk. Today's purpose isn't to go through the detail of that, so I won't, but that's the confusing part for some of the doctors. When it comes to what mistakes the doctors actually make, Here's a good example because I take all the phone calls. So these are the things that just came up literally this morning again, is that a doctor may have a corporation and maybe they sell one of their offices or whatever. They may take that corporation off of their policy or never list it in the first place. But if they get sued, and by the way, it doesn't cost to add the corporation. If they get sued, any attorney is going to name the corporation as well. And if you don't have it on your policy, you're going to be defending that corporation out of your pocket. And if you have associates or you set up chiropractors in another office under another corporate entity, and that's not listed anywhere on their policy as an extra or on one of your policies, someone is going to get hit. And it's the owner that always has that risk. So even if a doctor, as I said, sets somebody up in a different office under a different corporation, you would want to add that corporate entity to that doctor's policy as what we call an additional insured. And we go over all of this so the doctors don't have to worry about it as long as you tell us what the setup is. And if the additional insured is on that policy, everything's going to go through that doctor's policy for any mistake or alleged mistake that they make before it can ever come back to the owner. And that's one of the biggest things that the doctors should keep in mind. And one of the other things is just, it sounds so stupid, but pay your damn bill. You know, people don't pay it and then they don't take our call. They think we're harassing them so that they don't lose all of their coverage. And if they had a claims made policy and it lapses because they didn't pay their bill, they can lose coverage all the way back to day one, which could be 20 years ago.
Wow.
Those are the biggest things.
Yeah, I've actually seen that with doctors with us where we got notified or somehow found out that they didn't pay their own malpractice. Because when I was in Pennsylvania, I used to have my associates get their own practice or their own malpractice. And it's better. I can see there's a benefit now to having that under the control of the company and ensuring your guys all with the same coverage, because the only malpractice claim I ever had wasn't really against me. It was against somebody who worked for me. And all of a sudden I started realizing that his malpractice was adversarial to me. And they were trying to insinuate that I set up the situation that led to the malpractice when I wasn't even in the state. So it all worked out good in the end, but it's good to have one company covering you. So, okay, so tell me about your company then. What makes your company unique?
Well, first and foremost, I've got to say me. Even though you didn't realize it, I deal with your wife over all of these years. Yeah. And I love her because she understands insurance, but she's also another healthcare professional. And it makes things go a lot easier, and she knows her stuff. So when I say me, I have 37 years of experience as a chiropractor, being out there active in the community, as well as having practiced, having owned offices. But I also have 28 years now of experience in the malpractice arena and coaching doctors to hopefully de-escalate situations rather than turn into claims. And I would say to you, it is certainly my opinion that nobody can do that as well as me in teamwork with my son Eric, because we're the two that take the calls and we work on them together. And that's the first piece of it. The second is our policy. We absolutely have the most comprehensive coverage in the entire chiropractic market. I work with different underwriters to write the policies. The last update we did, I don't know, a year and a half or 2 years ago, Liberty Mutual is the parent company that writes the coverage. And we literally were in a room for 8 hours sitting and writing the entire policy word for word with what I needed to be in there to protect the doctors. Back in 2005, I added insurance audit defense to our policy where no one had it. No one even thought about it. But I saw it coming. I thought that that was going to be the greatest thing for the profession, because when doctors have enough money to fight back, insurance companies will leave us alone. Oh my God, was I wrong? And it's cost a fortune. But all the other companies, or most of them, now have audit protection to some extent or another. Not mostly, not as much as us, but still at least they're offering it. But
Right.
we've added now, we have cyber liability built into our policy for data breach. We have employer's liability. If you fire someone, they come back and sue you for wrongful termination. We're going to be defending you up to the limits that you purchase, and we have different limits available for the doctors to purchase.
Right.
So we have an incredible policy. We have what's known as a true consent to settle, which I would not ever buy a policy without that, because the true consent says, hey, I'm getting sued. I'm not going to listen to the insurance company. They want to settle this and get out of it. I want my good name maintained. And
Right.
sometimes that makes sense, and quite frankly, sometimes it doesn't. That's why you work with an attorney that's doing work on your behalf, and you get it worked out. But you will never have a claim settled without you signing off on our policy.
Wow, that's really good to have. So good. Well, I can understand, why Colleen liked your company so much, and she always handled the administrative side of things, and she always talked to me about how great of a asset you were to have as a resource. And I know over the years we have contacted you many times about different things. You've always been there for us. So talking about the chiropractic field, you've been in it for as long as you have. What changes do you think are happening, maybe not just from malpractice point of view, but for chiropractic in general? What do you see for the future?
Well, I see two different possibilities. First, I see a resurgence of people focusing on the chiropractic adjustment on one end of the spectrum. And on the other end of the spectrum, I see more of a cooperative approach. And the cooperative approach would be a more multidisciplinary approach to a healthcare environment where the chiropractor is still doing chiropractic. And I know that there, are things that you teach on that level. And I like that, because if someone says to me that I want to integrate my practice or this and that, I don't have a judgment call on it. I want them to still be a chiropractor, though, not to be billing chiropractic as a medical doctor or whatever. And I refer them to you because I trust in what you do in terms of what I've seen in the market. But the other side of it is I've always been a straight chiropractor. And I believe in the subluxation. I go out and talk about it. I don't believe drugs should be part of the chiropractic stroke. I'm very outspoken about it. I started organizations based on some of these tenets. I've been part of state and national and international associations my whole career. I speak and attend meetings probably 35 weeks a year. I'm leaving for Las Vegas tomorrow. In the next 7 weeks, I'll be in 8 different places. So, just different things at different times. But I always am optimistic. My concern is that no matter what school people are going to and getting out of, are they getting enough technique mastery? Because that was always the focus when I went to school, and what I gained out of it from school. My first seminar within a month of graduating was a technique seminar, and I knew all of the technique gurus, which some of them are gone at this point. But that's still a concern, is being a master at what you do, no matter what it is. And that's what I encourage even my boys that work at ChiroSecure. They need to master their communication and their ability to work and help doctors based on their own needs. And I say the same to the chiropractors. Master who you are and what you've got, and anchor that in. whether it be, a straight up chiropractic practice or as part of a group practice of some sort. You're still the doctor, you're still the chiropractor, and own it, love it, and succeed.
I agree with you 100%. That's good wisdom from a good person. So, Dr. Stu Hoffman, thank you for being our guest. We recommend you to a lot of people, and we're glad we do because of the way you present yourself and the way you believe. And I've learned things today that I didn't know, and I'm glad I had you as a guest.
Thank you. I appreciate it.
Okay, thank you. Well, so maybe we'll have you back again in the future. So, folks, for listening, docs, take the advice that Dr. Stu gave you today, and we'll see you next time.